Audio levels full volume. It's go time.
Broadcasting from the most powerful city in the world.
Ladies and gentlemen.
Welcome to the Power Table.
This is
The Power Table with Teresa Marie in the LBD.
Right now.
Teresa Marie has been a little long of a hiatus, and there has been a lot of activities with an S.
What's up, LBD? Hey, fam, how y'all doing? It's the Power Table.
Yes, we are back in action, man. And today we're going to talk about something that's all important to all of us because you are definitely experiencing this.
And one of the reasons why, we haven't been able to come together and do the Power Table.
Social distancing. We're talking all things coronavirus, COVID-19. And are we opening up too soon?
That is the question. We all are thinking about that. And when it does, as we're going through our phases, how are we supposed to move with it and through it? So we're going to talk to someone that will tell us all about that.
Dr. Larry Caplin is on the show today. So this is a show you don't want to miss.
Yeah, let's go. It's the Power Table.
The Power Table.
Dr. Larry Caplin, tell us a little bit about Docs Healthcare.
Docs Health is an organization that's been providing care for populations that have limited or no access to care for almost 30 years. We tend to do it with government agencies, so we handle health care for the Army National Guard across the United States. We bring care into public schools for kids who don't have access to care, all kinds of programs like that throughout the United States.
And Dr. Caplin, I do see here that there was an initiative for a student health impact project in Prince George's County. Can you tell us a little bit about that?
Sure. Prince George's, we're rolling out dental care and vision care for the students throughout the entire district, bringing it to the schools, getting care to a lot of kids that just weren't getting the care that they needed. So it's a great partnership. The Student Health Impact Project is a great partnership with Prince George's County, leadership. And the kids are fantastic, and the work's been a pleasure.
We appreciate that service and partnering with our community, and which kind of leads us to
the biggest question of them all.
How do we get back to it?
Yeah, this pandemic, COVID-19, man. Listen, is it something are we opening up too soon? Because we see the numbers fall, and now they're kind of increasing just a little bit again. Are we really opening up too soon?
I don't think we're opening too soon, but I think that, right now we have about a third of the country that has increasing numbers, and that's concerning. And I'm concerned about the amount of virus we're carrying into the summer. We expected it to drop down lower than this, and it's not dropping down as quickly as we anticipated. And then, of course, some of the social things that are going on are not necessarily going to help. So I'm a little concerned about that aspect of it, but we can both open the country and keep everybody healthy if we just follow the procedures that we've laid into place and people actually stick to them. So I don't think it's too early, but I think we really need to be careful, and we're going to have to pay attention to recent events and how that's going to impact our numbers.
So when we're looking at like Dr. Fauci and we're looking at scientists and these daily reports that are coming from the White House, and they're talking about COVID maybe going down in the summertime because of the heat, or it might be worse in the winter. Can you speak to that? How does that really play to us going into our summer season?
So the virus is a relatively stable virus, meaning it's not mutating a lot. It's not changing a lot. And we also know that it doesn't really like high heat and high humidity. Summer months where we have a lot more heat and a lot more humidity, that's why we tend to see the flu that's not our flu season. Mm-hmm. As we get into the winter and it gets cooler and drier, then the virus is much more stable. It survives longer, and it's easier to transmit. And then keep in mind, in the summer, we tend to be outside and away from, and we're not as congested. We're not inside of tighter spaces for as long a period of time. We tend to go outside and do things in the summer months. So the combination of that is why we get an increase in flu season in the winter months and a decrease in the summer months.
I'm glad that you said that and that you're talking about flu season, because that's also educating us in that area. We just know that the flu comes in, the winter or late fall, and then it stays till maybe the break of spring. But this is educational in that area too. I think with COVID, though, people may not be paying as close attention to it as they should. I think there are a lot of people driving to open up the country. What do you say about that?
You can open the country, because if we don't open the country, in all candor, we're going to have a bigger health crisis. We know in public health that poverty, joblessness, lack of education, schools being closed, are directly correlated to poor health outcomes long term for people. Yeah. So we can't sustain a closed society. It's not sustainable, and we're going to end up with a worse health crisis if we do that. But with that being said, we need to implement plans, and it needs to be implemented at every level, whether it's at your place of worship or your school or the business or when you're just out in public. People need to understand. We've done a lot to teach people about cross-contamination and infection control. We've taught them about how to pass disease from one to another. So we're not shaking hands and kissing and hugging like we were when we see people. We're now bumping elbows and staying further apart, and we're wearing masks.
Right.
All of that's going to help us, but each of those industries that I talked about or locations, they need to have a written plan on how they're going to implement in each of those places as well. If we do that, we can open.
Is that some of the important factors, the things that you just stated there, is that some of the important factors and practices that people need to consider when we're opening back up? Is that going to be the new normal?
Yeah, we're heading into the next normal, because I don't know whether it's new or old or what, but
Right.
It's the next one.
Right.
We are, yes, so on the personal side, hand washing, wearing masks, I would really encourage people to stop wearing cloth masks and go to actual medical grade masks. Cloth masks don't stop viruses. They may remind you that there's a virus out there because you're wearing it, but they don't. The virus is too small, the aerosols are too small, and the cloth fabric, it passes right through them. And people aren't washing them, so they become a source of potential infection. I really wish we would get people onto real masks and off of cloth masks, because I want to try and protect people.
I'm glad.
Like hand washing. Yeah, go ahead.
No, I'm sorry. I didn't mean to interrupt, but I'm glad you said that, because
I am too.
There was a thought process that was out there stating that the cloth mask will keep from people who may be asymptomatic from passing on to other individuals, not from a person catching it from themselves. Am I correct on that assumption?
It's not true.
Okay.
A cloth mask is, so I saw a meme that showed, it said, wearing a bandana to stop a virus is the same thing as putting up a chain link fence to stop a mosquito.
Ah.
Wow.
This is true.
The fabric doesn't stop aerosols. It doesn't stop the virus, the size of the virus. It just doesn't do virtually anything. And the problem is that people will wear them over and over and over again, and then they'll touch them, and they'll touch other things, and then they'll put the virus on them. And, so it actually could become a source of infection. I really wish people would go to medical grade masks and then dispose of them at the end of the day.
That is a great educational point and advice there. Because I don't think that we know that. I have the blue mask, and it's very uncomfortable, but I wear it, and we have to learn how to approach this differently and how to make these adjustments to address the unknown and also to address our fears. Can you speak to that? Many are fearful in our region, as we prepare to open. What are some of the important factors and practices people need to consider and remember as they prepare for this?
Okay, so people are fearful, and they have every right to be. This is not just the flu, right? I personally have had family members die from this, and I've had friends die from this, and they wouldn't have died from the flu. And we also have younger people who think that they're safe because they're younger and they're not going to die. But what they're not recognizing is 40% of the people that are going on the ventilators in the hospital are below 50 years old. And if you go on a ventilator for this,
I'm sorry,
you're
what
gonna
was
have
that number?
lung damage.
I'm sorry, doctor. What was that number again? Say that one more time, because I want to put an emphasis on that.
40% of the people who are going into the hospital for this are under 50 years old and then getting put on ventilators. And when you're on a ventilator, you have lung damage. And the longer you're on a ventilator, the more lung damage that you have. And what we're not paying attention to is the 25-year-old who went on a ventilator for 10 days or 20 days, and what the long-term effects are going to be for that 20-year-old when they're 45 and 50 years old. So people need to remember that just because you're young and it's not going to cause you to perish doesn't mean it may not severely impact your life on a go-forward basis. So you know, people need to be thinking about that and be mindful of not transmitting this disease and not catching it if they can avoid it.
I mean, that is very powerful to explain it that way, because this is new, so we don't know what the long-term effects are going to be, which can, again, go back to that fear factor. What are the basic, simple steps that we can do every single day to get in the habit and routine of protecting ourselves and our communities?
So let me talk a little bit about what we're doing with some of the organizations in the region here and some of the areas nationally. That'll give you a plan here.
Okay.
So even within we opened my offices across the country, and we put together a written plan that clearly states how we're going to operate in the office and how everyone's going to come here. That plan breaks into two parts. One is for anyone who's a customer coming, and then also all the employees. And then within that, anyone who comes into our spaces is pre-screened. So they go onto an app. We have an app called CapScan, and they go onto an app and they fill out health questionnaire and whether they've been exposed to anyone, and then they're given a code. When they show up at our space, there's a kiosk. They show their mobile device. It has with their code. It scans it and scans their temperature simultaneously. So now anyone who's potentially infectious based on their history or health is already being redirected not to come here. That's the first protection. Mm-hmm. The second one is I'm temperature testing everyone walking in the door and confirming that everyone in the door has been pre-screened. And then inside the space, we have a written plan that we implemented on how we operate within the space, what kind of distancing, everyone wearing masks. And that should be done whether it's for a place of worship, whether it's for a school, whether it's for an office building like ours. It does, whether it's a movie theater, we can run that same process. If you go somewhere and the people around you have not been pre-screened and haven't been temperature checked, then you should assume they're asymptomatic and contagious.
Let me ask you something a little bit off. They're talking about opening up sports, basketball, football especially, hockey. What is it that those individuals inside those sporting arenas or the athletes themselves, how can they actually perform these sports without being at risk? What are some of the things that they need to be aware of?
One thing they need to do is they need to test everyone who's going to be in that group. So think about it this way. Let's just tie it down to your house, all right, and your family. If you're all living together and you've all been tested and you're all negative, you don't need masks and you don't need social distancing, and you can hug each other and you can do all that because you're all negative and you're all in a confined space. So what they're looking at doing with basketball is having everybody move into the Disney complex and have everybody get tested and then keep everybody in that bubble so that you're not bringing outside exposure into that space. And as long as they do that, and they know that all the people that are working there that are involved have been tested and are negative, then you're fine. You're not going to transmit the disease. We think about everybody's focused on social distancing and the distance between people and thinking that there's something magical about 6 feet. 6 feet is simply a distance barrier between people. If you and I, Lamar, were standing on either side of a glass door that was a quarter of an inch thick, you and I could be a quarter of an inch away from each other, and we won't pass the disease to each other.
Right.
The virus.
Correct.
because we have a barrier. So it's not about 6 feet. It's about a barrier. And then the other part is it's about whether either of those people are infected. In the public, we don't know who's asymptomatic.
Correct.
In a sporting arena like this, we can test every single person and then keep them in a controlled environment for an extended period of time and then allow them to continue to compete among each other.
That makes sense.
But you can't open it up. You can't then let other people in unless they've been tested as well.
Yeah, thank you for explaining that. I was really curious how they were going to implement that.
Yeah.
So thank you so much, Dr. Caplin, for sharing that with us.
So if anybody has any kind of additional questions or if they want to see some of the guidelines that you recommend, how can they get in contact with you?
Yeah, sure enough. So docs.health, so DOCS.health is the website, and that'll have you can contact through to us directly through there. That's probably the easiest way to get in and get information that you need. And with that, we'll help people put the plans together to get their businesses open. We'll provide them with those kiosks I was talking about to do the temperature testing, and we can and also provide them with that app that we're using that allows for people to be pre-screened before they go into any of those locations.
Cool. We appreciate that.
I appreciate that, Dr. Caplin, because you gave an outline of how things are, what it is, how to move, why we should move, and how we should stay safe. So you covered all of it. Thank you so much. We appreciate your time today.
It is my pleasure, and I just want everybody to stay healthy and stay safe. And please keep doing the things we asked you to do. Wash your hands and keep some distance and wear proper masks. And we can get back to church and we can get back to school and we can hopefully end up with a healthier population as a result of it because we implemented behaviors that'll improve everyone.
Yeah, we got to get back to school soon. My college son is home, Dr. Caplin. He got to go back to school.
Oh, yeah, I got 3 college kids at home.
Just kidding.
Yeah, they're all arguing with me about everything.
He's not a problem, but I'm telling you, he's taking up a lot of space.
And they know everything about everything.
Right.
Thank you.
Ladies and gentlemen, that's Dr. Larry Caplin from Docs Health. We appreciate you. And if we have some additional questions, we want to take the advantage to reach out to you again as this thing progresses so we can get more recommendations if that's okay.
No problem at all. I'm happy to get together with you. You guys are a lot of fun. And the more that we could do to help everybody stay healthy and safe, the happier I am.
Dr. Larry Caplin, we appreciate you, my brother.
Thank you, Dr. Caplin.
Be well, man. Be well.
Stay safe.
The Power Table.
Teresa, good information from the doctor, man. A lot of things that we didn't even know that's very important right now.
Yeah, it stood out to me about the medical masks.
Yes. How about the people under 50?
Yeah.
That's just crazy in itself.
Yeah, we are still having to get more information about COVID-19 and how we can navigate our way through it. We will be okay. We just have to be smart about it. Yeah. So generally we'll do the T, like I have entertainment.
Right.
This is the T.
Right. Absolutely.
COVID-19 and how to make your way through it and stay safe and be well. That's the T.
Yeah, the T is how to keep you healthy because this may be the new normal for us.
Yeah. I think it is, but that was good.
So thank you, Dr. Larry Caplin, and we'll see you all on the next episode
of The Power Table.
You got it.
We back, baby.
Hit us up on the gram.
Follow the LBD on Instagram at @the_LBD1 and Teresa Marie at I am Teresa Marie.
On my timeline.
Thank you for having a seat at the Power Table.